Meet James, a young professional. He feels depression creeping in, but he cannot tell his family and friends because they'll see him as mentally weak. So he suffers silently and constantly contemplates suicide. Even if he gained courage, the nature of his work would not allow him to go to hospital. So he even goes to work when he is sick. Well, the story resonates to the life of many other individuals who suffer from mental disorders. According to Newsplex, 1 out of 4 Kenyans is likely to suffer from mental illness, and 83% do not receive any treatment. Depressed people lose up to 5 hours of productive work, which annually costs 101 trillion shillings to the work industry. Globally, prevalence of self-medication is now over 67%, which has led to over 30% of the drug abuse and addiction cases, according to the World Health Organization. Our solution, RemD, which stands for Remote Doctor, offers a solution to these individuals: confidentiality for individuals like James, remote consultation, drug delivery services, health alerts and information, and first aid tips.
RemD is a set of tools that allow real-time communication between pharmacists and patients. It is also a culture we are trying to build where medicine is easily accessible to everyone and anyone. Now, James can come to either of our platforms via an app or the USSD application. On the platform, he will select a service. In this case, he will select consultation, or a specialty, in our case, mental health. He will then select a doctor. He will now start talking to a triage bot and feed it with as much information about what he's going through as possible, which will now send all that information as a summary to the doctor, who, as well as it creates a session automatically. The doctor will then reach back to James via Windows application, which is also the doctor's dashboard. We created a custom Azure bot service library to interact with Africa's Talking SMS platform, as well as creating a Flutter library for consuming the Microsoft Direct Line API. We plan to open source all these amazing technologies we built in the near future.
In partnership with Fika Foods, who've already accepted our partnership, and Soko Watch, we hope to reach medical practitioners and the general population who are our target market. We'll charge them 50 shillings per session or 200 shillings per month on standard subscription, and for the doctors a 10% charge on their consultation fees. We hope to complete development, do testing, gain approval and licensing, add prenatal and postnatal services, and finally to gather enough data to improve the bot. RemD is all about inclusivity, service, innovation, and integrity, values which we believe are the foundations of the free world in which we live today. It is sad that in this day and age we're still grappling with challenges of health, so much so that they have been enshrined in the SDGs. But as George Washington said, the harder the challenge, the greater the triumph. And for RemD, our triumph will be RemD being the hospital of the future. Thank you very much.